How is extrapulmonary TB diagnosed? Have you ever wondered how doctors diagnose extrapulmonary tuberculosis, often referred to as extrapulmonary TB? This form of tuberculosis occurs outside the lungs and can affect various parts of the body, including lymph nodes, bones, joints, and even the central nervous system. Diagnosing it can be quite tricky, as it often shows nonspecific symptoms and involves less accessible areas of infection. The process usually starts with a thorough clinical assessment. Doctors take a detailed medical history and perform a physical examination. They look for symptoms that might suggest extrapulmonary TB, such as persistent swelling, pain, fever, weight loss, or neurological signs, depending on which part of the body is affected. Next, imaging techniques come into play. Doctors may use X-rays, ultrasound, computed tomography, or magnetic resonance imaging to spot any abnormalities in the organs or tissues. For instance, chest X-rays can reveal signs of pulmonary TB or pleural involvement, while an MRI is particularly useful for detecting TB in the central nervous system. Microbiological tests are also essential in the diagnosis. Samples from the affected areas, such as lymph node aspirates, pleural fluid, cerebrospinal fluid, or tissue biopsies, are examined. Smear microscopy can help detect acid-fast bacilli, while culture methods remain the gold standard, even though they can take weeks to provide results. Nucleic acid amplification tests, or molecular assays, have made it quicker to detect Mycobacterium tuberculosis DNA and can even identify drug resistance. Histopathology plays a critical role too. Biopsy specimens are microscopically examined for granulomatous inflammation and caseous necrosis, which are typical signs of TB infection. This step is particularly important when microbiological confirmation is challenging. Immunological tests, such as the tuberculin skin test or interferon gamma releases assays, can support the diagnosis by indicating immune sensitization to TB. However, it's important to note that these tests cannot distinguish between active and latent infections or pinpoint the disease's location. In recent years, emerging rapid diagnostic tools have been developed. These portable assays can provide TB diagnoses in as little as 1 hour using blood, saliva, or sputum samples. This advancement is especially beneficial in resource-limited settings, making it easier to diagnose TB quickly. Since extrapulmonary TB can mimic other diseases and may have low bacterial loads, a combination of these diagnostic methods is often necessary to confirm the diagnosis. Early and accurate diagnosis is crucial for starting the right treatment and improving patient outcomes. Overall, diagnosing extrapulmonary TB relies on clinical suspicion, supported by imaging, microbiological tests, histopathology, and immunological assays. The advancements in molecular techniques have significantly enhanced the speed and accuracy of detection, including identifying drug resistance, which is vital for effective management.